a case of measles in San Francisco, the first one in about 7 years. Health officials say it was when an infant who was infected, and it comes as the state is seeing an uptick in cases. So John Ramos has more on the recommendations from health officials, especially those who are planning to travel.
There are a number of diseases that we thought were in the past, but as more people fail to get vaccinated, some illnesses are making a comeback. The warning came in the form of a press release issued by the San Francisco Department of Public Health. On Monday evening, a child was diagnosed with measles, the first reported case in the city since 2019. Health officer Dr. Susan Phillip sounded the alarm. Quote, "Measles is one of the most infectious diseases in the world. If you and your family are traveling internationally, make sure everyone is up to date with the MMR vaccine and is aware of the symptoms of measles." End quote. Dr. George Hahn heads up the communicable disease branch of the department.
So this infant was under 12 months old, had been exposed to measles while traveling internationally, and then after returning home to San Francisco, became infectious with measles and was diagnosed.
The age is important because most children are not vaccinated for measles until they reach a year old, and generally they have immunity passed on from a vaccinated mother for the first 6 months of life. It is for that window, from 6 months to a year, that doctors now have a vaccine recommendation.
In the case of travel internationally or to outbreak areas, we would suggest talking to the pediatrician about getting it early.
But Dr. Peter Chin Hong says it doesn't have to be a foreign country anymore. The infectious disease specialist says there are growing areas of vaccine resistors, including here in California, that make travel for unvaccinated infants dangerous.
If the baby is going to an area of an outbreak, so there, for example, there's an outbreak right now in Sacramento and Placer County, and the baby is younger than 12 months, you might think about getting that child vaccinated. That child is going to be in that area, or certainly in areas like West Texas or Utah or South Carolina.
Measles can be fatal, but it is a disease that is only a threat to those who have not been immunized. Dr. Chin Hong says the MMR vaccine is safe and highly effective, calling it the poster child of vaccines. And at about 97% vaccinated, San Francisco has such strong herd immunity that it is unlikely a major outbreak could happen here. But just a few years ago, there was one in Disneyland.
What it revealed was that even though our state vaccination rate was high, there are communities where the vaccination rate is lower. So you can't just look at the average. You have to look at specific communities. And if the community has a low enough vaccination rate, it can spread from person to person.
He says a case of measles in the city was bound to happen, but it is really a matter of statistical bad luck rather than a growing problem. And for now, the only warning the health department is issuing is for people who plan to take their unvaccinated children to a place where a lot of people have failed to get the shot.
And a similar warning today from health officials in Sacramento and Placer counties, a total of 19 cases in that region. All of those cases involve children or teenagers, and health officials say many are being linked to homeschool enrichment programs. It is the biggest outbreak in that region in 12 years, but officials say the spread is relatively contained right now.